Assalamu alaikum friends, here is Sayyida OMAMA SHAH and today we will be discussing the anatomical areas in lower limb. So let's start. The first anatomical area that we are going to discuss is the femoral triangle. Here you can see the figure. The femoral triangle is a triangular depression located in the superior medial part of the anterior thigh. Superiorly, it is bounded by the inguinal ligament, laterally by the sartorius muscle, and medially by the adductor longus muscle. The floor is formed from lateral to medial by the iliacus, psoas, pectineus, and adductor longus muscle, while the roof is formed by the skin and fascia of thigh. The contents of the femoral triangle from lateral to medial are the femoral nerve, the femoral artery, the femoral vein, and the femoral canal. The femoral artery, vein, and canal are enclosed in a separate compartment. This fascial compartment is known as the femoral sheath. The femoral nerve innervates the anterior compartment of thigh. The femoral artery supply majority of the lower limb. The great saphenous vein drains into the femoral vein within the femoral triangle. The femoral canal contains deep lymph nodes and vessels. This femoral triangle acts as a conduit for structures entering and leaving the anterior thigh. So this was all about the basics of the femoral triangle. Now the second anatomical area is the adductor canal, also called as the subsartorial canal and Hunter's canal. It is called as the subsartorial canal because it is present deep to the sartorius muscle. This is a conical tunnel extended from the apex of the femoral triangle and ends in the adductor hiatus, which is an opening in the adductor magnus muscle. This canal serves as a passageway for structures moving between the anterior thigh and the posterior leg. Now, if we talk about its borders, so anterior-medially you can see the sartorius muscle. The adductor longus and adductor magnus muscle are present posteriorly, while the vastus medialis is present laterally. Here you can see the contents that passes through the adductor canal. The femoral artery, the femoral vein, the nerve to the vastus medialis, and the saphenous nerve. Here it is to be noted that the saphenous nerve is the largest cutaneous branch of the femoral nerve. Once again, I will repeat the borders here also in this figure. Laterally is the vastus medialis, posteriorly here you can see is the adductor longus, while anterior medially is the sartorius muscle. The femoral artery and vein, when exit the canal, they continue as the popliteal artery and vein respectively. So this was all about the adductor canal. So friends, the third anatomical area that we are going to discuss is the popliteal fossa. Here you can see in the figure, this diamond-shaped area is called as the popliteal fossa. As fossa is a depression. Here you can see a depression-like area located on the posterior aspect of the knee. This fossa is the main pathway by which vessels and nerve passes between the thigh and the leg. Now if you look at its borders, so superior medially it is formed by the semimembranosus muscle and the semitendinosus muscle. Superior laterally it is formed by the biceps femoris muscle. Inferior medially by the medial head of the gastrocnemius, and inferior laterally by the lateral head of the gastrocnemius and plantaris muscle. The floor of this fossae is formed by the popliteus muscle and the posterior surface of the knee joint capsule, while the roof is formed by the two layers, popliteal fascia and the skin. Now, if we talk about the contents in the popliteal fossa, so the main conduits for neurovascular structure is the popliteal fossa. Here you can see in this structure, the contents in the popliteal fossa are the popliteal artery, popliteal vein, tibial nerve, and common fibular peroneal nerve. Here the important thing that has to be noted is that the small saphenous vein pierces the popliteal fascia and passes between the two heads of the gastrocnemius to empty into the popliteal vein. This popliteal artery, as you can see over here, is a continuation of femoral artery, and we discussed it previously that when the femoral artery leaves the adductor canal, it continues as the popliteal artery in the popliteal fossa. So this was all about the popliteal fossa. So friends, thanks for watching and Allah Hafiz for now.